Let me see if I can share results. There we go. Okay, so I will get started with the questions now. You can still ask additional questions if you have any. Let's see. How do I inform my doctors of my condition? Most of the providers that I have do not have very much knowledge about dermatillomania. They're familiar with trichotillomania, but when I explain what I do to my skin, they sometimes look at me like I might be a meth addict. Yes, well, if they at least know about trichotillomania, you're very lucky because many of them just know the name and that's it. So now it's an officially recognized disorder. So there are diagnostic criteria that any psychiatrist should know. Maybe they don't know how to approach treatment because sadly, that's not something that we get to learn a lot about, but they should know what the condition is. If you like, you can, so there are blogs, I think, on the SkinPick website, and there is a organization called, the bfrb.org is the website. I cannot think of the name, I don't know why, even though I've been on that website like a million times, where your healthcare provider can find basically all the important and current information. So I think that would be the best way to do it. And also, if you can compare it to trichotillomania, that's a good start because they both fall within the same category of body-focused repetitive behaviors. If they know how to treat hair pulling, they should know how to treat skin picking. In fact, in my experience, skin picking tends to be easier to treat than hair pulling with the same principles. It's clear, thanks. Well, you're welcome, but I'm not sure which part you mean. I've come to notice that sometimes I have trances, not when I have difficult experiences, but rather happy and exciting moments. How can we deal with these kinds of trances? Yes, I thank you for writing this. That's really my oversight. I should have included this as well. I mentioned this when we talked about stress and anxiety in previous webinars. When we talk about experiential avoidance, we don't necessarily we're not overwhelmed only by negative experiences. Very often, if people have a hard time tolerating negative experiences, they sometimes have difficulties tolerating the positive experiences as well. Because for our bodies, happiness is also stressful, not just sadness. So I think one way that you can frame this is to look at it as a kind of difficulty coping with stress in general. Because when we talk about stress, there's a very simple definition of stress, which is that it's anything that gets our body out of the state of some sort of equilibrium. So anything that excites your body in a positive or negative way is stressful. So in that sense, technically speaking, good experiences are equally stressful as bad experiences. So what you might want to focus on is anything that would kind of calm your body and reduce its excitability. That's what I would do. Of course, it's a general advice because I don't really know the specificities. What does it mean if you find yourself in a trance when you're bored? So if this is your first webinar, then you don't know, but I don't believe in boredom. So like I said before, it's just a state when you don't have anything to focus on. If you find yourself in a trance when you're bored, that likely means that triggers are your thoughts or your emotions. So that's what you need to explore more and understand more. Okay, 1 second. I only pick at night when I'm bored watching TV. So that doesn't necessarily mean that it's a picking trance. That could just mean that it's mindless or automatic picking. In that case, what your first thing to do is to find a way to be more aware of what you're doing and then apply simple habit reversal techniques if we're talking about mindless picking. So since next time we will talk about habit reversal training, join the next webinar and you should get some basic principles about how to deal with this. Running works phenomenally for me. Yeah, running would be actually a very good way to deal with it. Yeah. Healthy constriction sounds like a flow state. Is that accurate? Yes, I guess we could talk about, so Kelly's theories from 1950s, we didn't really have flow theory, so he never really mentions it. But yes, that could be one way to constrict in a healthy way. But it's not just that. So, but it's everything that reduces your world to one thing. Yeah, flow state definitely would be one thing. Yeah. I'm not sure the idea of constriction as shutting everything out, but the sensation of picking applies from my experience. I will often pick while reading on the computer. It almost seems to help focus on what I'm reading. Is that correct? Does that connect? So that would be, like I mentioned in the previous or the question before that, that would be just automatic picking. So a trance involves a kind of immersion into the experience of picking. I will assume that you haven't experienced intense trance-like picking before, because I think most people who have immediately, actually the word trance is not at all let's say a technical term. It's something that clients use spontaneously, even without really exploring what other people say or how we talk about this. So people usually really recognize the trance when they experience it. What you're describing, that picking helps you focus, is really rather common. But then maybe next webinar, when we talk about habit reversal, will be practically more useful for you. So that wouldn't be constriction, no. Picking in subsequent trance is very calming and brings a sense of peace. It unfortunately is a very pleasurable experience, although the results are terrible. Yeah. So your experience, I think, really sort of goes well with the experiences of other clients that I shared at the beginning. Yeah. That's, I think, the biggest disaster and the biggest problem with the picking trance is that it is so calming and even pleasant. Because when something is so validating and so effective, it's very difficult to replace with something else. This is why competing responses don't work, for example. And yet to find a competing response that provides that amount of pleasure. I think in some strange way, I think even sedatives don't really work as quickly and as effectively as a picking trance does. It's not healthy, but it is difficult to treat because it has this punching bag. Yes, thank you. That's what it's called, yes. A punching bag can help. Is hitting or destroying something or yelling at someone really a healthy alternative to skin picking? So I didn't mean that you should yell at someone, but very frequently clients have reported that just yelling itself, like just yelling, is a way to get those emotions out. So it is healthy. When I say healthy, I mean anything that does not cause any more physical damage to you. And when I meant destroying, I really didn't mean that you should, I don't know, burn down a building, God forbid. I meant like you can use paper and then rip it up. You can use that wrapping paper, for example. Again, I'm missing words. I don't know what's wrong with me today. Like the wrapping paper that you can press and pick, basically. You can use squeeze balls, those squeeze toys that are kind of soft. You can use these and pick them, for example. This is not a technique that I found in any book that deals specifically with picking. This is something that a lot of CBT therapists will use for clients in general when they experience very intense emotions. I've seen people who deal with dialectical behavioral therapy. They sometimes will use these ways to redirect intense emotions when people want to self-harm. So one way that you will do that is to actually destroy something else, so something that doesn't have a lot of value. And again, when I meant yelling, I just meant yelling, not at someone. So do not hit people, and I do not advocate for violence, just to be very clear. Do you think there's any benefit to cosmetically trying to fix the scars as inspiration to get better? Or better to fix the behavioral aspect first? Well, if you can afford, you can do both at the same time. I always advise people to have, if I even suspect, or if they suspect that they have, for example, a dermatological condition, I will always ask them to have a consult with a dermatologist, because if there is something that will provoke you to pick, like a skin condition or a scar, then yes, it really does help to do that because it's a type of stimulus control. Essentially, what you do is you remove something that will cause you to feel the urge to pick. However, I think getting better overall, the motivation shouldn't be scar removal. I don't like how I phrase that sentence because it's not like there's one thing that motivation should be. But what I'm trying to say is that the motivation, when we change psychologically, what gets us through the process of change is not necessarily even the result or at least the temporary result. It's just the desire to be better. So that kind of motivation comes from the inside. It doesn't come from outside. But if your scars will trigger you, or if they cause so much shame that they actually prevent you from doing things that would maybe benefit you in terms of reducing your picking, then by all means, why not? I don't object to this at all. Just to kind of try to find the motivation in self-love, I guess, of some sorts, or self-compassion. Can you suggest some guidelines for an accountability partner? I'm reluctant to involve my spouse because he tends to yell at me to stop picking, which simply aggravates the shame. Yes, so telling someone to stop picking or yelling or shaming people really never works. In fact, just when I read these things, I just want to yell back at them. It really just does not work. In fact, it backfires. So one thing that, okay, let's put it this way. When someone is your accountability partner, they need to know that they're your accountability partner. So this is not just calling someone because you love them. This is a very specific job that they have to do. That means that they need to find a way to get you out of the room where you pick, and they need to find a way to calm you down, or at least help you calm down. So that means that you need to talk to them and establish some ground rules. If your spouse really wants to help you, then they should help you in a way that helps you, not the way that they think helps you. Because oftentimes when they yell, it really comes out of a place of powerlessness and not knowing what to do and not knowing how to help. So what you need to do is to think for you, what would it be the best that they do? So what can they do? Should they hug you, hold your hand, get you out? I don't know. Whatever would, I'm laughing because my weird mind is coming up with some very strange solutions. But the point is that you need to figure out what would work for you. So what words you need to hear and what proposals or suggestions or guidelines, yeah. So you need to figure out the guidelines for your partner and then work with them to learn them. But they need to be able to help you in the way you need help. Usually what I will suggest to people is to first have a very quick way of communicating something. So don't bother explaining, honey, I think I need your help because I think I'm going to have a picking trance now, or I am in the middle of one. That doesn't work, takes too long. You need a keyword or a key gesture or a sound that you make. So something that will be very quick and very simple to recognize. And then once your spouse hears the signal, they need to have a procedure of what they do. My suggestion from what I know that works from working with clients is, one, to get you out of the room, and then second, to provide some sort of emotional support. This depending on what kind of a person you are, you might actually want a hug, a kiss, or something like this, or he might drag you to do something together, to be involved in some sort of activity that will basically remove your focus from the urge to that activity. So running, someone mentioned that would work well, or puzzles, or I don't know, boxing, whatever will help you defocus. It's very individual, so it's hard to give general proposals, but one, find a short way to communicate, give him an algorithm of what he needs to do, and that can include also the words that he needs to say. And he really needs to promise that he will follow through. This is the first webinar that I have seen. Is it possible to view any past sessions anywhere? Yes, so you will receive a link to YouTube where this will be uploaded. We usually upload them in two separate files. One is just the webinar, and then the second is the Q&A. Because when you upload a 2-hour-long file, people just instinctively don't really want to go through it. So it will be in two parts. And when you get the link, just check the channel. You will have all the webinars there. Does the SkinPick program have a high success rate? Yes. In general, when it comes to skin picking, psychotherapy is much better than any kind of medical treatment, at least according to the studies that we have now. And our program is based on habit reversal training and acceptance and commitment therapy, both of which have been empirically shown to benefit. So you can expect to experience a symptom reduction when you complete the whole program. Can I TLC? Yes, thank you. That's the website. Is it possible to complete the program in fewer than 8 weeks? No. So explicitly, no. So the program is designed in a way that you can't possibly complete it before the 8 weeks expire, because you can only open 1 session per week. And also, before, when I started working for the program a while ago, it was possible to pace yourself and sort of open sessions when you want, but it was significantly less effective than it is now. And I'm very happy that this change was made, because it takes time to implement each of these techniques. You will see next month when we talk about habit reversal, it's establishing a competing habit. No one does that in 5 days, so it takes time. And many people will join the program and then say things like, yeah, but I'm really very mindful, or, you know, I'm like super introspective and I know everything about myself. Still no. So it doesn't matter. Like, I've had therapists who are very reflective people and who actually think about themselves in a very systematic way and who know how to introspect, and they still needed more than 8 weeks. So there's no Superman when it comes to therapy. And the format of at least 8 weeks or more is something that is, let's say, a standard model for CBT. What is RAIN? So I believe I answered this question, but just briefly, it's a way to deal with intense emotions. It's based on mindfulness, but it's not a formal meditation. It's just a four-step procedure to kind of remove yourself from intense experiences. Healing the skin and ensuring that the skin itself is not a trigger. Do you find any particular methods work better than others? I've tried everything from gloves and Vaseline in my hands to retinol on my arms to heal spots. So all the things that you mentioned here, they can work, but you need to be really clear about what you want to achieve with them. I suggest you look at it in 3 parts. 1, how to heal your skin faster. 2, how to find ways to redirect the urge onto something else. And 3, how to minimize the urge. So that's a very simple plan, but if you work on all 3, you can achieve good results. When it comes to the skin, I can't really tell you what would work best for you, because I'm not a dermatologist and there are so many skin types out there that it's really depends on what you need to find. Basically a skincare routine that works for you. So something that you will apply once or twice a day to keep your skin clean and healthy. You can also use additional supplements that will help your skin heal faster. Some things are really very banal, like vitamin C, for example. Vitamin C helps with collagen synthesis, which is something that you really need if you want your skin to heal from picking. So that's something very simple, available to everyone, that you can also use. There are other vitamins that can help as well. And you even have vitamins that are kind of customized for skincare. So that's something. When it comes to redirecting the urge, those are competing response techniques. And I will talk more about them next time, since habit reversal is something that won this month. So that would be our topic for next month. And then the third thing would be stimulus control, which is when you identify what your triggers are, make sure to find ways to avoid them or to alleviate them entirely. If it's stress, then deal with stress reduction. If it's mirrors in the bathroom, covered mirrors and things like this. But you need to use all 3 parallel to each other and to implement them very systematically. So I really, so that I don't give like an hour lecture on habit reversal training, just tune in next month and you should get very precise instructions. How does one get started with picking? What sets it off? So that's very different for different people. But the general mechanism that I talked about in the beginning, which is experiential avoidance, this is typically what the whole thing revolves around for most people, not for everyone, but for most people for sure. So usually the stories that I will hear about how skin picking starts is something like I saw someone do it, and then I tried it once, and then I realized that there was something interesting there, and I kept doing it. And then another type of story would be that there's a lot of perfectionism attached, and then there's a lot of sort of, but when I mean perfectionism, I mean in how you present yourself to others, and then picking is just grooming that goes awry. And then another set of stories would be directly related to the kind of trance story that we hear now, which is usually that people find this enormous amount of relief from doing it. But usually it's not like, sometimes you will see people who learn picking from their parents. It can be like a learned behavior. Sometimes I've had stories where parents have actually taught children to pick their skin, not necessarily to teach them to, have dermatillomania, but as a way of grooming, which then takes a life of its own. So those would be some common, let's say, origin stories that I hear. What are the results at the end of completing the SkinPick program? So I think you should find on the website, they have the stats somewhere that they updated, but typically over 90% of the people who complete the program in a reasonable amount of time, so someone who is actually compliant and regular, over 90% of the people will experience significant symptom reduction. That doesn't mean that you register and things happen on their own, but you have to be very active in the program as well. Because obviously psychotherapy is not about intellectualizing, it's about actually applying these insights in real life. How do we deal with guilt after a trance? This is a very good question and a very important one. So with the client that I mentioned several times, for her, guilt was related to self-judgment. Basically, she would tell herself that she's, a horrible person, that she's weak, that she has no willpower, and things like this. When you catch yourself doing it, so first of all, set the intention to stop and then counter it with something that will actually help you. Someone asked about skincare, and then this is where working with guilt can come into place. If you did pick and if you did cause damage, that's horrible and it sucks and it's very bad. So guilt, obviously, and self-judgment adds more suffering, and we don't want to add more suffering, we want to remove suffering. So what you do is you take as best care as you can of yourself. So after you did pick, what you need to do is make sure to clean your skin and to apply something that will help it heal and something that will prevent infection. And then you should find something that comforts you to soothe yourself emotionally as well as physically. You can do something that feels better. You can talk to someone that you trust, anyone who will be able to provide some sort of compassion for you. Or one thing that you can also do is actually practice self-compassion actively by using a guided meditation. You can go to selfcompassion.org. It's a website that's kept by Christine Neff. She's a psychologist and a researcher, and she studies self-compassion. And she offers a lot of, there's like 7 or 8 self-compassion meditations that you can use and actually just take that time for healing. I'm a clinical psychologist working with a perfectionistic, intelligent, and delightful 16-year-old. Her parents are very motivated for her to overcome skin picking, she less so. In fact, parental control likely contributes to negative emotions that lead to skin picking, yes, and probably even maintain picking as well. Though on thoughts on adolescent motivation, and thank you, glad to find expertise here. So yes, this is very frequent when you work with adolescents. And usually what I do immediately is that, so I don't know what kind of therapy you practice and whether or not you're limited by the number of sessions that you have. But what I would do is I would tell the adolescent, and I often do this, is I say, okay, so you're stuck with me because they're bringing you here. So let's use this time to work on something that you think is important. So focus on whatever it is that she wants to talk about. And then slowly try to make connections between whatever it is that she's saying and skin picking. Or better yet, ask those questions so that she makes the connection herself. But in my experience, the only entrance you have there is whatever it is that she wants to talk about. If it's how much your parents suck, then let's start with that. And then slowly work your way there. Because if you look at what's beneath perfectionism and what's beneath skin picking, it's often very poor self-image and very little self-worth. And these topics are, the core of what you should be treating, and you can access them in many, many different ways. So whatever she brings, you can use that to work with her. I remember at one conference, it was a while ago, and I don't remember, it was in Venice or somewhere. Anyway, it was a therapeutic conference. It was a constructivist conference. And there was this therapist who talked about shoes and hair, and how she talks about shoes and hair with her female clients, but actually she kind of reaches very deep topics, those that deal with identity and these very core important issues. And at first that was still when I was younger and much more cynical, and I thought I know much more than I actually did. And I thought, well, this is really ridiculous. Like, who goes to therapy to talk about shoes? But then when I actually saw the presentation and saw the case that she was making about how symbolism works and how you can actually talk about your hairstyle, but you're actually talking about how you present yourself to the world, and therefore you're talking about how you're actually projecting the kind of person you want to be, I thought, yeah, this actually does make sense. So whatever trivial thing she offers, be very kind of, just trust whatever she says that it's important, and just be very naive and talk about that. And then you'll find your entrance eventually. When you reach topics such as self-respect or self-worth, whatever entrance you find to these, you're doing well. And once you get consent, you can actually apply practical, like habit reversal tools or parts of ACT or whatever therapy. How can I stop bullying? How can I stop the bullying in school when I have been diagnosed with dermatillomania? Well, if you're experiencing bullying in school, I'm afraid that this obviously is a psychological topic. But stopping bullying is not a psychological topic. That's a matter of your parents. I don't know how old you are, your parents and your school and your teachers and your professors. So I think the first thing you should do is, if you have a school counselor or someone you trust, you should confide in them. If you have a therapist, you can talk about bullying, but it is very important to take these practical steps to stop it. What does it mean if you started picking after a traumatic skin infection? I've heard that it's been known to happen. Yes, it's been known to happen, but in that case, essentially the infection that you have is just a trigger. Everything else about, whether the trigger is this or something else, or like a scab or a pimple, it's really not relevant because the mechanism is still the same. I would suggest, if you want to work on this on your own, the direction that I would give you to think about is what was going on in your life when you had this infection, and specifically if you can remember the first time when you did it, how did it feel, and why did you start doing it in the beginning? Because that first connection that was made between picking and relief is very important. So that's where if you can think about that period and figure out why, that will give you some idea about what the mechanism is in terms of why picking has stayed for a long time. Otherwise, I think you can apply everything from the beginning of this presentation anyway. So you can think about it as a form of experiential avoidance. And if you want to find techniques to deal with it, you can join the webinar next month or join the program or anything. Or there are even books that you can read, but I think psychotherapy is always preferable to self-help. So if you can afford therapy, that's much better. Can we get a copy of this Zoom session? So you will get a copy of it, like I said. The meth addict comment rang true for me too, because I have experienced the same stigma. How do you approach doctors when they get confused about what they're treating? I'm a pain patient who picks, so what is a good way to say this isn't drugs, it's skin picking? So like I said, you can go to the TLC website and just print out the information for your doctor, but really, and this is maybe not the nicest thing of me to say, but I would slightly shade your doctor. So if he thinks you look like a meth addict, they really then need to talk to you about this. Making this kind of an assumption based on someone's skin is absurd. So no one should be deciding what you are based on what your skin looks like. That's just not good medicine, to put it very simply. So if your doctor doesn't have information, you can send him a link to the SkinPick YouTube channel. He can find all the webinars there. The website also has resources. The TLC website is excellent for your doctor to learn. But if you want to explain it very briefly, you can explain that it's a BFRB, so body focused repetitive behavior, that it shares some traits with obsessive compulsive disorder, in the sense that it's not you because you have nothing better to do in your life that you're picking. And you can sort of explain things about maybe experiential avoidance. This is something that a doctor who graduated from medical school should be able to understand. And really, anyone who graduated from medical school has no excuse not to know what skin picking is. Absolutely none. But again, if there's one resource that I would recommend, it's the TLC website. They really have, like, it's explained very nicely, like what are some theories about it, what are some treatment options that people have, so your doctor can get all the basic information there. I think they even have a page that talks about medication and even about recommended dosages. So you can do that for sure. And also, you don't really have to, the reason why I'm so bothered right now is because it is not your, like, you obviously, if you have to do it, you have to do it, but you shouldn't educate your doctor about how to treat something. He should or she should educate himself or herself. So you can explain what the condition is, and depending on the type of treatment you're seeking, they should go and learn. You shouldn't have to go and say, well, I need this and this medication, or refer me to a therapist. So you should explain what the condition is and leave them to educate themselves. You can suggest resources, but it's really their job. It's hard enough to struggle with skin picking. You really don't have to go around educating people who are supposed to help you with it. That's just too much. It's like being a parent to your parents. It's unnatural. When I watch a movie, no matter what kind of a movie it is, I pick through the whole thing. I have developed arthritis in my thumb and fingers due to a lifetime of picking. So this could be the automatic mindless picking that we talked about, in which case next month I will give some tips on how to become more aware of it. But the first step that you need to do is to be aware that it's happening, and then you can apply techniques to stop it. This is not about trances, but I was wondering, do you think it's okay to tell people that I have dermatillomania or skin picking disorder, even if I haven't been formally diagnosed, just make explaining easier? Yes. You can go, so the ICD, the International Classification of Diseases, the one that most of the world uses, but not the US, but they have all the diagnostic criteria available for free on their website. So World Health Organization has it somewhere on their website, and you can really easily see what the diagnostic criteria are. It's not magical. It's, you know, skin picking that lasts for a long time. It causes you to feel bad and causes some sort of dysfunction. So it's not something that you need a highly skilled professional to diagnose. Yes, of course, it's okay to say it. And also, I think it's really good to work. One way to defeat shame is to actually put a name to it and just tell people. What is the relationship between skin picking and self-flagellation or self-mutilation? So they are different things entirely. Skin picking belongs to the category of body-focused repetitive behaviors. Self-flagellation, self-mutilation, and other forms of self-harm belong to a different group of behaviors and are associated with different mental health problems. That said, they often overlap. So you can have both self-harm and skin picking, and they can persist as different types of behavior and sort of exist parallel to each other, or they can overlap, in which case it's sometimes very difficult to discern where skin picking ends and self-harm begins. So by default, they don't have a defined relationship, but they often overlap in my experience. Because self-harm, to an extent, also has this function of release that skin picking also provides. Often when I work with people who have not in skin pick, but as part of my practice, offline. Well, not offline anymore because of COVID, but you know what I mean, like outside of the SkinPick program. When I work with people who have borderline personality disorder, for example, they will often use self-harm as a way to deter, to sort of replace physical pain with the emotional pain. And picking does something similar on a less destructive scale, and it's not associated with other symptoms that follow borderline personality disorder, for example. So they can overlap, but they are distinctly different things, diagnostically speaking. If you haven't experienced a trance before, I would describe it as being stuck in the mirror. Yeah, that's a very good way to describe it, being stuck in the mirror. Is there hope for clearing the skin of blemishes after over 15 years of picking addiction? Sometimes I fear I can truly be changed. So yes, you can. If you have scars from picking, scars are likely to stay, or you have to at least apply some treatments, some sorts of treatments to remove the scars. But sometimes so the reason why you have blemishes when you pick is because every time when you pick, no matter how careful you think you are, you always cause a certain amount of inflammation. Any tissue damage will cause inflammation as a response. So you don't need an infection to have an inflammation. This is the normal response of your skin to it being sort of damaged. Basically the inflammation serves the purpose to remove the damage that's been done and set the terrain for healing later on. What happens when there is frequent inflammation in similar places? Basically, you get a form of chronic low-key inflammation, and this can cause your skin to be pigmented in these places. This type of pigmentation can be permanent, but it's often not. It just lasts for a very long time. So even after you stop picking, you will likely need more time for your skin to heal entirely. So if they stay for a long time, don't be demoralized. Just think of it as a process that takes a long time to go away, because the inflammation lasted for a long time. And so without going into how it's created, even though it is fascinating, it can go away. It just takes a long time. I pick all the time when watching TV, on the phone, at work, when I'm reading by myself. How can I keep track of what triggers it? I have been picking for 24 years since I was a teenager, so sadly picking feels like a part of my life, but I want to stop and feel better. Thank you. Yes, this is very difficult to track, and no one expects you to be able to track each specific episode, especially if it's present all the time and if it's mindless or automatic. So one thing, start with what you can notice and write it down. Or even better, you can use the habit aware bracelet, because it will or keen aware, however, there's several of them in the market. They don't really give you a whole solution, obviously, for picking, but they are very good for noticing that you are picking when picking is automatic. So every time you move your hand, for example, if you pick your face, when your hand goes towards your face, the bracelet will vibrate or make a sound or whatever it does. So in that very moment, the only thing you need to pay attention to is what I was thinking and how I feel. And this is perfectly doable, because especially if picking is present so frequently, triggers are more likely to be internal, because otherwise it would be the whole world that's triggering. So that's not a reasonable assumption. It's more likely that it has to do with how you feel or what you're thinking about. I started to pick after the loss of my son paired with insomnia, started 4 years ago. I've gone to grief counseling and OCD therapy and have also been put on tranquilizers. There are no doctors or therapists that work with this condition in my area. I have stopped picking my legs, but my arms are still a mess. Would this 8-week program be able to stop the habits and trances? I have not heard anyone use that term. The trances are very intense. Well, like I said, this is not a term that's a technical term that you would hear a therapist. I guess it should be a technical term in some sense because it's a very common phenomenon. But since there's very little literature, it's not like people actively research it in huge numbers. So, you know, this is the term that people use who are not professionals, and I think it's okay to give a more formalized meaning for it because it's a very distinct phenomenon. So let me just go back to the question. Would the 8-week program be able to stop the habits and trances? You would certainly be able to reduce your picking. By how much and whether you would lose it entirely, it would be incredibly impossible to say, because you know it depends on. In my experience, people who experience intense picking tend to benefit more from the program. Also, how much motivation you have and how much time and what exactly is behind your picking. All these things affect how much you can benefit from the program. But overall, statistics say that you would benefit from it. You would learn the tools. So even if you don't necessarily stop entirely during the program, you would at least have the tools that you need, and you would know sort of where to go next. And then you would know how to work further along. So you can for sure benefit from it. Let me see. I have read that picking makes the body produce tiny amounts of a biological opiate. Hope this makes sense. Yes, it does. Is this your experience? If so, if this isn't part of the reason why it's so hard to quit picking. So this is one of those moments where I think that biological explanations really don't contribute anything useful. Yes, you get a certain, like every time you do something that calms you down, there will be a chemical released in your brain. The same way that every time when you're sad, there will be a chemical equivalent to that. This is because everything that our body does has to, in some way, relate to our brains and has, you know, like intense emotions will obviously have chemical correlates, whether or not they're good or bad. And orgasm also has a similar biological response, but no one is going to say, well, orgasms are very hard to deal with because they have a chemical basis to them. Everything that we think or do or feel has a chemical basis to it. That's just a given of how our brains work. But you are right, because it is so pleasurable, that's why it's so hard to quit picking. But it's not pleasurable because you have a chemical in your brain. That's not why it's pleasurable. It's slightly more complicated than that. Of all the things that can be pleasurable, you can ask yourself, so why is it that this is pleasurable for you? I don't think that answer is in biology, it's in your experience and how your experience interacts with biology. I feel that there are a lot of similarities to drug or alcohol addiction in the way that it's used as an outlet to provide relief, even if not healthy or productive. Would you agree with this? Yes. Actually, when I was talking about this, when I was saying how it allows you to calm yourself down and to be relaxed without actually having to process whatever made you upset in the first place, I had this thought in my head, oh, well, this is like alcoholism, basically. Because people often drink so that they would, you know, get rid of the intense emotion, but don't really address the issue. Yes. Do you think watching extraction videos like those from Dr. Sandra Lee has an effect on one's symptoms, either by exacerbating symptoms or potentially relieving them? Well, I've seen people who were triggered by this. Even sometimes when in webinars, when people share experiences and when I give examples, just thinking about this will trigger people. I don't know exactly how this is supposed to help you, to be perfectly honest. If you get some pleasure from watching it, then I can imagine that it would help, but I can see it perhaps more as triggering than anything else. I was in psychoanalysis for 5 years, 4 sessions per week, which I left cold turkey feeling harmed by the therapy and started picking again soon afterwards. I had stopped while in therapy because I felt ashamed of my skin in front of my therapist. I'm very familiar with much of what you have said today, but not everything. I wasn't aware of trances. Although I can relate now, I think it will help. Thank you. You're welcome. I'm sorry to hear that you had such a bad experience with psychoanalysis. I have really utmost respect for psychoanalytic theory. I think it's interesting that you should feel ashamed of your skin in front of your therapist. Since you were in analysis for so long, I guess you already know that it's maybe a part of transference. So that's where I would look for the answer. And if your analyst actually did something to shame you for it, well, that's a whole different matter. It's more counter-transference thing. I've had a terrible few days and I picked so badly today. I feel like there's no way to just snap out of a trance. Yes, like I said, the most effective way with the trance is to attack it in the beginning or just before it's about to begin. Once you're in it, it's like a black hole. It's extremely difficult to just snap out of it. This is why outside some people can help. And this is why I said the technique should be applied in the very, very beginning. I text my best friend who also picks. Even if she can't answer, messaging her that I'm struggling is sometimes all it takes to snap me out of the trance. Yeah, I agree. It's sometimes just putting it into words kind of reflects back what you're doing. Yeah, I agree. Thank you for doing this webinar and giving the word trance to the experience I knew I had but couldn't quite describe. I have struggled with self-excoriation. Instead of picking, I actually squeeze my skin. As I mentioned before in the Q&A, I had a trance that went from 11 p.m. to sunrise for 6 hours or more. I ended up squeezing a good portion of the skin off my left cheek and ended up with facial cellulitis and preorbital cellulitis. Oh gosh. Knowledge from someone who understands this helps me. This sounds very intense. I'm so sorry to hear this. Not just 6 hours, but the resulting infection. I can imagine the consequences. I mean, I hope there's something useful for you here. And by all means, tune in next month for the habit reversal. I mean, it really sounds like you could benefit from at least this form of help, if not from offline therapy. My psychologist didn't know about this condition until I presented it to her. The dermatologists usually know about dermatillomania. Well, technically, anyone who went to medical school should know about dermatillomania. It's only been recently, even when I went to medical school, it wasn't an official disorder. It wasn't in the classification. Trichotillomania was, I believe, but skin picking wasn't. It became now after, I think, the last revision. So every doctor should know. Even if it wasn't officially a disorder when they were in medical school, they should follow that sufficiently to know that it is. So every dermatologist should know about skin picking, and certainly every psychiatrist, every psychologist, every counselor. Maybe they don't know, they don't have the skills to deal with it, but I would be really surprised that they don't even know what it is. After all, it is in the books now. So if you follow your field, you should be informed. As a 17-year-old, how can I get my parents to understand why I pick and that it takes more than a few years to heal over? So again, I mentioned the TLC website several times. You can maybe refer your parents to go there. If your parents have any questions, they can also email me and ask. If you have a school counselor or anyone else, sometimes, you know, parents don't trust their children, unfortunately. So if they don't believe you, then they can believe the official resources. So they can email me. I would be happy to answer any questions that they have. TLC website has a lot of materials as well. Again, so just refer them to someone whom they will consider an authority figure if they don't trust you. But I agree that they really should understand how difficult it is. It's not something you just stop one day. If just looking at my skin triggers me, would you recommend wearing gloves or anything else? Wearing gloves is a good stimulus control technique, but that only works, I guess. If you want to remove the trigger and your skin is triggering you, then I think maybe removing mirrors would also work, depending on, you know, what area of your skin. But wearing gloves tends to be quite effective, yes. Even if that doesn't trigger you, if you struggle with mindless picking, for example, while you watch TV or do something, wearing gloves or finger covers can be quite helpful. People are very reluctant to try that for some reason, but it is very efficient. My partner taught me how to knit to keep me from picking, and I repeat the same stitch over and over again. This is a helpful redirection from picking, so I wanted to share in case it helps anyone else. Yes, that is quite helpful for two things. Yes, it keeps your hands busy, but this is also something that you can actually focus on and use that as something to block out the world. Like that can be your constriction, for example. Any suggestions for when you live in a shared house and pick in your bedroom? There's a good stimulus control, which is to just leave your bedroom and sit in the living room with other people. Most people will not pick in front of others. And if you have people who are cooperative and who understand, you can explain it to them and they can actually help you. So if you have people around you that, in my mind, unless they're very annoying people, and if they're even remotely willing to help, they can be of great, great help. I used to have skin picking trances as a child or a teenager, but I didn't have enough self-awareness to make myself stop or realize that it was a problem. Do you have any advice to help younger skin pickers? So younger clients have one great advantage, which is that their brain is incredibly flexible, so they can change more easily than older people. This sounded kind of harsh, but it is true, because there's more neuroplasticity in younger brains than in older brains. So if you have to change a habit, it's much easier to do it while you're younger. I think when you're young, I think it's very difficult to use any kind of self-help. Even when you're an adult, self-help rarely works because we really need someone to keep us accountable. So if you know someone who is young and who picks their skin, refer them to counseling. You don't necessarily have to say, well, you have this and this disorder, so go and get counseling. Try to point out the connection between how they feel and what they do, and explain, the benefits that they would have from understanding their own emotions. Adolescents don't like to be stigmatized, so if we can avoid words like disorder, that's great. So anything that you say that would imply they're, let's say, you can say things like you'll be calmer or happier or something like this, like work in the direction of avoiding calling it a name. And maybe work more with self-worth, self-confidence, and things like this. Those are the concepts that they will more likely understand than, look, this is dermatillomania, go and get treatment. Often I feel my spouse is under so much stress when he sees me picking or knows I am. This stress builds and sometimes comes out with anger and condescension. This makes me feel very much responsible for his discouragement and stress. Do you have a suggestion for my life situation? So first of all, you're not responsible for anyone else's emotions. Dealing with picking is really hard enough. You cannot take responsibility for how he feels. The fact that he feels bad just indicates that he loves you and that he has no tools to help you. So give him tools. Figure out what is it that he can do when you pick to help you stop picking, and then tell him to follow your instructions. Frustration just means that he is helpless. Men typically don't tend to be the most emotionally literate people in the world. We don't really like to be helpless, so we lash out with anger. But that just means that anger is the other side of the coin, and the coin really says, I don't know what to do and I want to help you. So just give him specific tools. Tell him what he can do to stop you, tell him what he can do to shorten the episode or to minimize it, or at least what he can do to kind of, if you need to be left alone, then tell him that. But if he if he's angry and he lashes out at you, then that stresses you, makes your picking worse, makes his anger worse, and then you spin in this circle of negative reinforcement, and that doesn't help anyone. So just give him very precise instructions about what he can do. This has been an excellent session. Thank you. Well, you're welcome. I'm glad you enjoyed it. I've asked my spouse to help alert me when he sees me picking, but when I'm in the middle of picking, it's really hard to stop until I can smooth out the area. I get annoyed at my spouse. Is there something else he or I can do? Yeah, so maybe just telling you to do something isn't enough. And if your spouse is fine with you being angry, you can actually allow him, or at least, in advance, allow him to interrupt you somehow. He can hold your hand, for example. You can go out. Find something that you do, even if you are annoyed. Tell him that even if you say something, that's not the nicest thing, it's not, you are grateful, really. So he needs to know that he is helping you even if you are annoyed. But it is okay that you're annoyed because he's interrupting you, but keep in mind that it is for your own good. Just come up with a good strategy how to do that effectively. So if he interrupts you and then you become annoyed and then go back to picking, that's not really helpful. In fact, it makes it worse because you'll just be annoyed, which will add to your stress and therefore make picking worse. So figure out what is it that he can do, no matter how annoying it is, that stops you for good. So find that one way of dealing with it. My air conditioner is making weird noises. Just wanted to say that this was wonderful and very informative. Loved hearing from you, and so cool to learn about Lee Krasner's art as well. Very interesting to note similarities between her and Pollock. Yes, they're similar, but she has a very distinct style. And if you like abstract art, I really recommend that you research her a little more. She was an incredible painter. And sadly, she was overshadowed by Pollock, who's, to be sure, one of my favorite painters, but she's really, really something special. How to deal with a trigger that is a skin condition that is untreatable, like keratosis pilaris. Yeah, so in that case, I suppose the only, you can't, I understand, you can't treat it. You can maybe make it a little bit better by taking care of your skin and following whatever regimen your dermatologist gives you. But the direction that I would take in this specific example is to work on acceptance and on habit reversal. But acceptance is really the key. If you can't treat something, then you have to learn how to relate to that in a way that's healthier. And so if this is the only, so think about it this way. This is, I think, a very good example when psychotherapy would be very helpful. Even if your therapist doesn't know how to work with specifically skin picking, with acceptance and body image, most therapists know how to work. And this is another way to frame this. Because if you have an untreatable skin condition, then this condition is a part of your skin. So when you have an issue with that, that is an issue with body image as well. So this is something where any therapist should be able to help you. My mom picked my skin. Yeah, so this is not a very common story, but it does happen very frequently. And then people continue doing that. And in these cases, it's really worth investigating the family dynamics and sort of what was the role that picking played there in your relationship with your mom. Is skin picking related to eating disorders? I used to have one of those, and I have always wondered if the behavior is just an extension of excoriation disorder. So it's not related in any way formally. Sometimes there will be an overlap, but I have to say not very frequently. One thing where they do overlap is body image. Like the previous question, basically, this one is just it's the same answer. So the body image and your relationship to your appearance is what connects the two. So I can absolutely see how in therapy, psychologically speaking, they might be related, but in terms of psychiatric classification, they're not related. But then again, psychiatric classification is just a manual for recognizing mental health problems. It's not, it doesn't say much about what symptoms mean. So that's something that's very individual, and it's from person to person. I never understood it, but then I started as I became older, and I noticed it provided relief to my anxious thoughts. My daughter catches me picking, and I'm afraid I will pass it on to her. How can I prevent this when this is the coping mechanism I have used for so long? So you can use this is the same person, without saying a name, who mentioned that her mother used to pick her skin. So it is already let's say, a pattern of behavior that's in your family. So I think the best way to do that is to actually deal with it, and maybe even share your struggle with your daughter once you manage to get it under control. The fact that you used it as a coping mechanism for a very long time means that it might not be easy to replace, but it is not an excuse not to replace it. People sometimes seek help when they're 70 years old after 50 years of picking, and they still find ways to reduce their picking significantly. So can you. So this is, your daughter can actually be a very good source of motivation for you to finally deal with picking. So it's been almost 2 hours. So let me just, there's still around 20 questions that I didn't answer. Let me just choose like a random one. and then we can slowly finish. Thank you for answering my question. Are there any specific bracelets you recommend to help us be aware of the peaking activity? Brand names, generic names? Are there any keywords? So there are the bracelets that I mentioned, the habit aware bracelet. This is not like just this is basically like a smartwatch, which you train to recognize certain movements, and then it's not going to activate every time you move your hand. It will activate specifically when you make the picking movement. Let's put it this way. These bracelets come in very handy to help you increase awareness of picking. A part of habit reversal is becoming more aware of picking, because you can't really apply techniques to stop it unless you know that you're doing it. And these bracelets can be very helpful. I'm not sure about, so there's many of them. Habit aware is the one that I always recommend because it's the name that I'm used to saying. But if you Google habit aware, I'm sure you'll find others as well. If you can't afford, I'm not sure about the price. It's not terribly expensive, but it's not cheap either. If you can't afford to buy habit aware, there's some very basic stuff that you can do. You can wear a very heavy bracelet on the hand that you use to pick. Because when you have something very heavy on your hand, it will make you more aware of that part of your body, simply because there's something that's, under quotation marks, unnatural to your body. Another thing that you can do, you can use a bracelet that makes a lot of noise when you move. I mean, you can also use a bell and just wear it on your hand, because every time you move it, you will hear a sound. Whereas you can be unaware of your body movements, annoying sounds are much more difficult to neglect. So that's also something that you can use. People also wear, for example, hand cream, or if you pick your face, you can put like a face mask, because every time you touch it, that will also increase awareness. But obviously that's a limited strategy. Okay, so there's still questions coming. I'm really sorry. I think I'm running out of my voice at this point. I think we can stop here. If you have any questions, I mean, I know that you have questions that I didn't get to, unfortunately. So you can email me, and I will answer your questions in writing. I typically answer questions on Monday because I get a lot of questions after every webinar. So I dedicated some time on Mondays to answer these questions. I might get back to you tomorrow or day after tomorrow, but Monday is the most likely day when I will answer your question. Really, by all means, email me. I will be happy to answer anything I didn't have time. And thank you for sticking with me for so long. And I hope to see you in November when we will be talking about habit reversal training. Well, have a pleasant evening, and I hope some of this was useful for you. Bye.